Alright, so for next up, we'll talk about the pathophysiology of heart failure. Pathophysiology of heart failure. Okay, so pathophysiology, you're just trying to look at what are the several things that actually led to this issue coming in. You understand? Okay, so pathophysiology of heart failure. This is just a simplified diagrammatic illustration, but we'll get to talk about it. All right. So from the diagram here, we have that if there's excessive work being placed on the heart, okay, it leads to issues in the muscles of the heart. Okay, so there could be loss of muscle cells, all right, leading to compensatory response. Do you understand? So it's what actually leads to what? A lot of stress being put on the heart, all right, then what could ultimately lead to what? The heart failure. The muscles can actually get tired too. Okay, so let's talk about it. So heart failure is when the heart is not being able to what? Pump enough blood to meet what the body is demanding. Do you understand? So these things could actually be from the amount of blood filling into the heart. So if the amount of blood filling into the heart is small, of course the heart will be pumping out small. If the amount of blood the heart, or sometimes the amount of blood that is filling into the heart is normal, but the heart is not pumping out sufficient. Do you understand? So the key component of pathophysiology is reduced cardiac output. So the heart is struggling to pump blood effectively. So organs and tissues receive less oxygen and nutrients. So compensatory mechanisms. So the body tries to fix the low outputs, but these fixes can backfire over time. All right. So the sympathetic nervous system is activated to make the heart beat faster to compensate. All right. But this can actually lead to issues with blood vessels. Renin-angiotensin aldosterone system retains sodium and water to increase blood volume. Do you understand? But if the volume is too much, it leads to overload. Also leads to edema. Okay. Ventricular remodeling. All right. The heart muscles can thicken or dilate. Of course, this initially helps, but later on it could actually lead to what? The heart failures. Okay. So fluid retention and congestion, of course, there's too much fluid in the body. Do you understand? So it could actually lead to edema, leads to difficulties in breathing. So symptoms you might see: the person is weak, there's shortness of breath, there's swellings in their leg and abdomen, there's also swellings around the eyes, there's poor feeding and growth failure. Okay. So in children, feeding difficulties, poor weight gains, all of these are signs. So things that might actually lead to this heart failure include all those cardiomyopathies, also infections, okay, also heart defects. So that's it for the pathophysiology of heart failure, how this condition actually comes about.